Welcome to the video on treatment options for mechanical neck pain. Physiotherapy typically involves a combination of different treatment options for various conditions, and mechanical neck pain is no exception. Exercise, manual therapy, acupuncture, education, and different electrotherapeutic modalities are combined in specific ways and at different points in the recovery timeline, which is unique to each patient. Modern, high-quality physiotherapy involves evidence-based practice, which means that clinical decisions are guided by three things: clinical research findings, the experience and judgment of the physiotherapist, and the experience and preferences of the patient. The table here summarizes the different overlapping treatment options that tend to be used with the various symptoms caused by mechanical neck pain. Use the time index to view examples of the various treatment techniques of interest, keeping in mind that they are used and combined uniquely with each individual case. So when we find a limitation in movement that we think is related to stiff joints, manual therapy techniques are then used to restore the motion. So I've already assessed Rhiannon here, so we know she has a restriction in the middle part of her neck, that C5 area that was seen earlier in the diagram. So we have found that she has a stretch pattern of pain where her left side of her neck does not open. So we're using movements to isolate the area and make that left side open a little bit. Depending on her pain level and sensitivity, there's different techniques that can be used. So in some cases where there's restriction in movement, spinal manipulation can be used. That involves some screening to make sure it's the right technique for Rhiannon. I've already screened Rhiannon for conditions that wouldn't respond well, and she's okay with that comfort-wise, right?
Correct.
Okay. So in positioning Rhiannon, we want to isolate the segment of the spine that we think is restricted. Okay, you okay there?
Yep.
And I'm going to do a little thrust here. Okay, now we retest her movement and check that that restriction has improved. Neck traction is used in a lot of cases with mechanical neck pain to increase the space between the joints, between the openings where the nerves exit, or as an easy stretch for muscles without irritating them. In the case of Rhiannon, we can add an extra focus on the left side by repositioning her in a side flexion like so, and a little bit of forward flexion while doing the stretch. Moderate stretching at the joints, muscles, or nerve root openings can allow patients to provide their own relief for any of the 5 symptoms discussed earlier. Another technique to increase movement where there's a lack of opening, say on the left side, are mobilizations, which are slow, rhythmic stretches with a lower force, which is used when someone's not comfortable with manipulation or when the condition is too sensitive to use a higher force, or when someone has possibly an underlying health condition which makes manipulation not the best treatment. An exercise for increasing the rotation occurring at the very top of the neck is this towel snag, which we're going to demonstrate with Lori. So Lori holds with her left hand there, the towel, the edge of the towel goes across the very top part of her neck, across just under her eye. In a slow manner, she's pulling with her right hand, making her head turn. She will do this not to the point of pain at all, but repeating about 10 times, a couple times a day. So in many cases with mechanical neck pain, the deep neck flexors and the top are not working very well, need to be retrained. So there an exercise that we can have Rhiannon do. First thing I'll have you do is put one hand under your head. So that hand's going to feel the weight of your head. Your other hand, I want you to feel these long stringy muscles here at the front. So the movement we want is to do a chin tuck without tightening the muscles that we don't want to take over. This hand is checking to see that her head doesn't lift up, that it's only the nodding motion but not the lifting. So just tuck your chin down and see that your head doesn't lift up. So we'd have her do several repetitions of that over time, and then we would progress it as she gets more stable. So in many cases of mechanical neck pain, forward head posture is a factor that needs to be corrected. So we're going to have Rhiannon just looking, she's exaggerating the situation there that we want to correct. It's a good model. So what we have her do is sit herself back in the chair. Use the web space of your hand, put it above your mouth, and without lifting her chin, we just want to have her head retract backwards toward the wall, and your hand pushes a little bit. So she's keeping her chin tucked there to see that the head doesn't lift into extension, which would be an aggravating position for her. Just like the deep neck flexor exercise shown earlier, training to improve the coordination and endurance of posture control muscles in the upper back, lower neck, and shoulder blades is needed for successful posture correction. In the case of cervical radiculopathy, the nerves exiting the spine at the neck, going down the arm, get sensitized. That pain can be alleviated by small gliding movements without stretching it to restore the normal sensation and reduce the numbness, tingling, or pain that's felt. So, having Rhiannon in a comfortable position with her neck tilted up a little bit, I take up the slack in the nerve, the median nerve that's coming down the arm, in a position like this, without causing any numbness or tingling, but just a little bit of a stretch. From there, I have her wrist in my hand here, going in the same direction as her head. So her head tilts to the left. I moved her hand at the same time, and tilting to the right. And this way, you can see why it's called flossing, because both ends are moving together in the same direction without causing any painful stretch in the nerve. So another consequence of mechanical neck pain, of course, is muscle tension, which most neck patients have. One way to reduce that is by manual therapy techniques of mobilization or manipulation. We can also use acupuncture, which acts like a dimmer switch for the nervous system to turn down the muscle tension. So in Lori's case here, we know she has tension in the upper trapezius muscle here. Sometimes when people have headaches from neck pain, the suboccipital muscles up here are the cause. So in acupuncture, we're using our very fine needles to stimulate that muscle and alter its muscle tension. So Lori's in a relaxed position, and I'm picking the points which I know are related to nerves that affect the muscle tension of those muscles that we've talked about. How you doing there, Lori?
Great.
So you let me know if you're not feeling good.
Okay.
So like all treatments, we would question her to see that she doesn't have any condition that we think wouldn't respond well to acupuncture. In some cases, patients are on blood thinners. There's some points that we would leave out. Some people just don't like it and makes them queasy, so that might not be the best thing for them. But in most cases, there's very little discomfort or anxiety at all from it. You okay?
Mm-hmm.
Right, so from here I can add extra stimulation to the needles by twitching them a little bit. I can add a muscle stimulator. In old school Chinese medicine, you would sometimes heat the needles with an herb called moxibustion, which is not really done too much anymore. But we would then use this to complement our manual therapy and our exercise to help settle it so she could get on to her more active treatment sooner. So part of retraining the fine coordination of the neck muscles and joints are using a joint position sense exercise. So we're going to have you move your head in a smooth manner, find the bullseye on the left, and then come back to the center. Now, with your eyes closed, try to find it again. And now open your eyes and see where you are. And now go back to the middle. Close your eyes and try again. Try to find the bullseye. And back to the middle. So an exercise like this, we can retrain the neck's ability to know its position and its movement by finding the bullseye, and we're able also to come up with a score to record our progress. In summary, mechanical neck dysfunction can lead to other symptoms in addition to neck pain. Headaches, arm or hand tingling or pain, dizziness, and thoracic pain can all originate from the neck. I hope that the viewer has a deeper understanding of the variety of techniques and the individualized approach used by physiotherapists in addressing mechanical neck dysfunction, as well as screening for other more serious conditions that need medical attention.